Fetal therapy, a branch of fetal medicine. It is focused on the health of the baby even before birth. It includes a series of interventions on the sick fetus with the aim of achieving fetal well being. Interventions may be medical, surgical, and its teamwork of obstetricians, pediatricians, geneticists, endocrinologists, surgeons working together for early diagnosis and management. High risk pregnancies. The primary selection is maternal undernutrition, presence of chronic illness like diabetes mellitus, hypothyroidism, and thyrotoxicosis. Bad obstetric history, Rh negative blood group. Secondary selections are maternal infections, APH anemia, multiple pregnancies, PROM, which is the premature rupture of membrane, poly or oligohydramnias, RH isoimmunization, PIH, and early onset of labor. Malformations. The definition is a structural defect in the body due to abnormal embryonic or fetal development. For example, cleft lip and cleft palate. Zygote, fertilization of sperm and ova. Embryo up to 8 weeks of gestation and fetus 9 week till birth. Patterns of malformations, we can have syndrome, which is group of anomalies due to simple or similar etiologies, for example, Down syndrome due to trisomy 21. Associations, clusters of malformations that occur together, for example, vectoral association. Disruption, extrinsic event during normal development, for example, amputation of digits or limbs. Then comes the deformation, like physical force act upon previously formed structure, for example, the club feet. If we look at the malformations, the etiology can be chromosomal, genetic, teratogenic, unknown. Morphogenic errors can occur, which can affect the developing structures, and primary structure defects can occur. For instance, there will be failure of the neural tube closure, resulting in myelomeningocele, which is a malformation. Deformation, extrinsic fetal constraint, and intrinsic fetal akinesia are the etiological factors. There will be abnormal force, normally developed structures, or altered structures or position. They will develop, but their position will be altered due to either extrinsic or intrinsic factors. And intrauterine force, when it occurs, it can result in clubfoot formation. So the club feet are deformations. Then comes disruption. The etiology is vascular, compression, or tearing. We can have vascular occlusion or abnormal force, abnormally developed structure, and it can result in destruction of the tissues. That destructive forces can occur, and once there is destruction at wrist, it can even end up with limb reduction deficit, as we can find in amniotic band syndrome, which can amputate it. So that is one of the destructive force.